everyone, welcome to my channel and to this video. My name is Mallory and I am a mom to Max, our little boy who's about 3 months old, a military wife, and a registered nurse. And in this video, I'm going to be walking you through what to expect with a C-section. I feel that I am qualified to talk about this from a professional perspective as a registered nurse. While I don't have labor and delivery experience, I did complete the required L&D clinical for getting a Bachelor of Science in Nursing, and I did get to witness a cesarean birth. And also from a personal perspective, because I actually had a C-section myself with Max. If you are interested in this kind of content about postpartum and newborn stuff, mom life, make sure to hit the subscribe button down below. I have a lot of stuff planned for you guys over the coming weeks. All right, so let's talk about C-section preparation. Part of this is going to hinge on what kind of C-section you're going to be having. Some of you may be watching this because you have a planned C-section. If you're having a planned C-section, which means you're going to have it on a certain day and time, you will be asked to fast for at least 8 hours ahead of time. This is because you could have a reaction to the spinal medication that you'll be given. You could have vomiting, and we want to minimize that risk. Or if you end up having to go under general anesthesia, which is rare, but it does happen, we want your stomach and your bowels to be empty as possible for the same reason, so that you don't throw up and then aspirate, which means you don't want liquid getting into your lungs, causing pneumonia, all of that. Now, if you have an unexpected or an emergency C-section, which I had, then obviously you won't be intentionally fasting beforehand. Now, unexpected, I just want to make this little clarification. Unexpected and emergency C-section are kind of two different things. And even within emergency C-section, there's like different kinds. So an unexpected but not emergency C-section would be if you've been in labor for a really long time and you're just not progressing or something of that nature, then the decision may be made for you to have a C-section. In that case, you probably will not have been eating because you would have been in labor for that time. So you'll be in a fasting state anyway. But if it's an emergency C-section, like in my case, Max was breech last minute. I went to my 40-week appointment. It was found that he was breech. We scheduled a version procedure for the next morning, but I ended up going into labor the evening before. And so there wasn't enough time I had started fasting for the version procedure, but I had only been fasting for like 2.5, 3 hours. Also, if you're having a planned C-section, you'll have more time to determine what you want. You can choose to have what they call a gentle cesarean, and I think I'm going to talk about that later in the video, but you can choose your preferences. You have more time to plan. So this is why I encourage you, even if you're going for an unmedicated vaginal birth, C-section is nowhere on your radar. That's how I was. I was like, no, I'm going for the unmedicated vaginal birth. My mom had very uncomplicated pregnancies and births, and I kind of expected to do the same, but he ended up breech. So even if you are fully intending on having a vaginal birth, I would still write down your preferences for if you have a C-section and talk with your doctor about it. I did write down what I would have wanted for a C-section, but now that I've gone through it, there's other things that I would have requested if I had really thought about it, and I did not talk about those preferences with my doctor. So I highly, highly recommend planning for a C-section, even if you never use those plans. The time to labor has come and you go to the hospital. First, you will be taken into a surgery prep room, and this will be different than a labor and delivery room. You'll be asked to completely undress, to put on the gown, the hospital gown, and maybe the no-skid socks, and you'll have put on a blue surgical cap. Your husband will also be given scrubs and foot coverings and a hat and a mask to wear into the OR. While you're in the surgery prep room, they'll be doing some standard medical procedures like inserting an IV, most likely into your hand. They'll start the IV fluids. They'll hook up the fetal heart rate and contraction monitors. And then they'll also ask you questions, intake questions like the last time you ate, your allergies, hopefully your birth preferences, who is baby's pediatrician, things like that. You'll have a hospital wristband put on, and you'll also have blood drawn to just double check that everything is good to go with your blood counts and everything. Make sure that it's safe to have a spinal, because in some circumstances you may need general anesthesia for medical reasons. And if you have actually gone into labor before your C-section, so this happened to me, I was in labor when I came to the hospital, they will check you for dilation. Also, in the case of a breech baby, they will use an ultrasound to double check the positioning of the baby, because if baby has somehow turned, and if you're in labor, then you can just go to a labor and delivery room and don't have to have a C-section. So they just want to double check that a C-section is warranted. Other stuff they'll probably do to you is they will put sequential compression devices on your calves. So those are these things that squeeze every now and then in sequence to prevent blood clots. So they'll put those on you. They probably won't turn them on yet, but they'll put them on. They'll probably give you a shave so that they can make a clean cut and they can put the bandages on without anything sticking. They may ask you to wash your whole body with an antiseptic. They did not have me do that. They just cleaned me up in the OR. I'm thinking more if it's a non-emergency situation, you might do that. But since mine was emergent, that might be why they didn't have me do that, or that was just the policy of the hospital. Also, while you're in the surgery prep room, the nurse and your doctor should explain the procedure to you. Like, don't ever agree to a procedure, like obviously, unless it's like totally emergent and you're unconscious and you can't. But typically you need to have the procedure explained to you by your doctor before you sign any consent forms. So make sure that happens. I'm sure it will, but just to be aware. The anesthesiologist will come in and talk to you about the anesthesia. If you get the idea, there's a lot of people coming in and out of your room. So most likely you will have a spinal block, which means that they shoot anesthesia into your spine and it numbs you from about the chest down. But if you have been laboring, like you were planning on giving birth vaginally and then something happened and you had to go to a C-section, you may have an epidural. So they would just use the epidural for the anesthesia. And then the pediatrician on call will talk to you, or the pediatrician that you've selected. And then also, I mentioned about a gentle cesarean. So if you haven't discussed this beforehand with your healthcare team, right now is the time to do it, if you have the chance. So a gentle cesarean entails making the cesarean birth not as surgical, I guess you would say. So some options for a gentle cesarean would be having a clear drape. So typically when you have a C-section, they put this blue drape up so that you can't see what's going on. But that can be a little traumatizing for some people. And so more and more hospitals are allowing you to have a clear drape so that you're not like seeing your actual body being cut, but you are able to see your baby the instant that they come out of your womb. One of my regrets is that I did not ask if that was possible. I wish I would have. Make sure that you at least ask. The worst they can say is no, we don't do that. Another option would be to have music playing in the background, aromatherapy going. You could ask to have skin to skin right away in the OR. That's another thing that I wish I would have specifically asked about is, can I do skin to skin with my baby in the OR if I'm in a position to do so, like if I'm not like totally knocked out or whatever. Those are some things that you can ask to have done to have a gentle cesarean. Okay, so then now let's talk about the actual C-section surgery. So I actually walked into the OR because I wasn't numbed yet, and they're like, okay, we're going, and we like walked into the OR. But obviously if you have an epidural already, or if you've been laboring for a long time, then you'll be wheeled into the OR, and then you'll be either put on the operating table, or like for me, I just stood up on a stool and sat down on the operating table. And so if you're in a position like me where you're like coming in for a C-section like that, and you haven't been laboring in the hospital, and you don't have pain management in place yet, so you'll sit on the side of the table, and you will have a spinal put in. So for the spinal, it's very much like getting an epidural if you have had one before. So you will need to roll your shoulders forward as much as you can, and arch your back as much as you can. Maybe I'll try to go to the side. And I am not actually a very good person to demonstrate this because I have rods in my back and I can't really curve my back. So you're probably normal and you don't have a fused spine, but you're gonna roll your shoulders forward, and you're just gonna arch your back, and you're gonna put your chin to your chest. So you're gonna be like this, okay? And somebody is probably going to be standing in front of you, putting your shoulders down and forward, and you're just gonna be in that position. That is so that the anesthesiologist has the best position to insert the spinal. So a spinal, basically, they will numb the area, and that will be the most painful part of it. They'll numb it with a numbing agent, which will entail a needle going into your spine. So yes, a needle will be going into your spine, but it'll just be really quick. It's like kind of like a bee sting. It'll get numb, so you shouldn't really feel much when the actual spinal goes in. So then they insert the spinal, they insert the anesthesia, but no device stays in your spine like with an epidural. So they'll put the medication in, and then you're good. Then you have to lie down pretty quickly because the anesthesia takes effect pretty fast. So you'll be assisted to lie down on the table, and you will start feeling your legs and your lower half going numb. And I describe it like a warm wave just washing over your body. That's the best way to describe it. But you should be able to feel your upper chest and your arms. Now, a very common side effect to spinal anesthesia is shaking. And I definitely was shaking, and you can't really prevent it. They probably will give you warm blankets because an OR is very, very cold, but it doesn't totally stop the shaking. So you'll lie down and you'll put your arms out like this. You're not tied down or anything, but it'll feel like you are, but you're not. They'll put a pulse oximeter on one hand, on a finger, and that is to measure your oxygen. And then on the opposite arm, they will put a blood pressure cuff. And the reason they put it on the opposite arm is because they don't want blood circulation being cut off to your oxygen. So you can get a false reading. So they'll put a blood pressure cuff on the other arm. Your anesthesia team will be either over here or over here behind you. So they'll have this big screen. They'll be monitoring everything. Your anesthesiologist will not leave your side. As they start prepping you, they'll put that blue drape up. So they'll put it up, and then it goes like over your stomach, and it's very, really fascinating. And then people will be prepping you. Your sequential compression devices will be turned on, so they'll start squeezing. You'll have a urinary catheter put in. They'll wash you up where they're gonna do the cut, like all around there. And by this time, you probably won't really be feeling anything because you should be numb by this time. And then before the surgery starts, one of the nurses will call a timeout. And a timeout is basically where it's like a huddle. I mean, you're not like literally huddling, but everyone stops what they're doing in the OR, and the nurse reads out things like the patient's name, birth date, the surgery being done. It's basically to check and make sure that you have the right patient for the right surgery. Okay, it does happen where the wrong surgery is done on the wrong patient. It's horrible, but it does happen. And so that timeout is so important. So after the timeout has ended and everyone is confirmed, like, yes, this is the right patient and the right surgery, then your doctor will do a test cut to see if you're numb, to make sure that you can't feel anything. And so in mine, I heard my doctor say, "Hey, Mallory, how are you feeling?" And I said, "I'm feeling great. Everything's fine." And I knew that he had tested to see if I was numb, and I couldn't feel anything. So after that, after they know that you're numb, then your husband will be brought in and he will be seated on the other side of your head, like whatever side the anesthesiologist is on, then your husband will be on the other side. He'll have like a little rolling stool and he'll sit there. He'll be all gowned up, and really getting the baby out is usually pretty quick unless there's complications, but it really should only be a few minutes from the time they start cutting till your baby is born. So that's super exciting. It's such an amazing moment to hear that first cry, no matter how it happens. So usually the doctor will hold the baby up so that you as the mom can see it. Like if you don't have a clear drape, they'll hold the baby up so you can see. Dad can stand up and take pictures, and then the baby will be taken over to the pediatric team so that they can, suction the baby and make sure that the baby, or obviously the umbilical cord will be cut. I think that's another thing that you could request for a gentle cesarean, is to ask for delayed cord clamping. So the baby will be taken over to the warmer and just made sure that everything's fine. They'll do the APGAR score test and just make sure that baby is stable. And if they are, like Max was totally fine. He was screaming, he was breathing, everything was great. So then once they determine that baby is stable, then they will swaddle them up and bring the baby over to your chest. And of course, if you're gonna do skin to skin, then they won't like totally swaddle them. So they'll bring the baby over, they'll lay them on your chest. Your husband will help you because most likely you're shaking, and it's just not super safe for you to just hold the baby alone. So they'll help you do that, and you'll be able to bond a little bit for a few minutes. If you're not doing like extended skin to skin, then the baby will be taken away to the recovery room or the nursery for more checks and stuff like that. And then your husband should be able to go with the baby. So then stitching up starts right away, and that does take the longest. So it takes like 20 to 30 minutes to get you cleaned up, to get you stitched up, to make sure that everything is fine with mom. And then after that's all over, then you'll be transferred to a hospital bed and you'll be wheeled into the recovery room. Okay, so a few words about C-section recovery. So you'll be in the recovery room at least an hour, if not 2 or 3. It just depends on how you're doing. So at first, your baby will not be with you, most likely, and the post-anesthesia care nurse or the PACU nurse will be doing her checks on you. So you'll probably be getting your vitals checked every 15 minutes, like your blood pressure and your oxygen, all of that. They'll be going over all of that. If you're up to it, they may bring you ice chips or water to sip on. I was so thirsty. It was so good, especially like if you were fasting for 8 hours. And then once you are stable, then your baby will be brought into you by the nursery, and you'll be able to do skin to skin. If you weren't able to do it before, you'll be able to breastfeed, and that's just such a precious time. Your husband can be in there. It's just such a wonderful bonding time. And then after a couple of hours, then you'll be taken to your postpartum recovery room, and you'll have your hospital stay. So C-section moms typically stay in the hospital for 3 to 4 days. I had him around 2 a.m. on a Wednesday, and then we were discharged on a Saturday afternoon. And your legs will be numb for most of that first day. My big goal for that first day, for Wednesday, was to be able to get up and walk. And I was able to do that, which was such a fun accomplishment to actually get up and walk. You will still have your catheter in until you are not numb. I did keep it in until the next morning, and they took the catheter out on Thursday morning, and then I had to pee 3 times before I got my IV taken out. So you probably won't be hooked up to actual fluid, but they want to keep that in you until you are clearly like able to drink and eat properly and urinate. You also should be allowed to shower. You know, you can get your bandages wet, you can take a shower. And so I did that on Thursday evening. It was lovely, so nice. And I really encourage you to lean a lot on your husband and the nurses for help. If you have a vaginal birth, you're able to get up like an hour after your birth. I mean, you know, you can get up right away, but with a C-section, you're going to be bedridden for most of that first day. And even after that, the incision is going to hurt. You're going to be moving. You just had major surgery. And so you're not going to be moving very quickly after any surgery, but not only did you have a surgery, you also birthed a baby. So you're dealing with these 2 huge things. So lean a lot on your help. So important. It was really hard for me to get him out of the bassinet those first couple of days. I needed somebody else to take Max out and give him to me. So yeah, don't feel embarrassed about asking for help. So that is basically what a C-section entails. I'm not going to go into details about coming home. I think I talked about that in another video. And if I did, I can't quite remember. I'll put it in the cards up above. But anyway, that is kind of the start to finish overview of a C-section. Of course, everyone's will look slightly different. That's the basics based on my experience as a nurse. Well, I was a nursing student at the time, but based on my professional and personal experience. So if you have any questions about a C-section, especially a C-section in an emergency situation, which is what I was in, I will say that some emergency C-sections you will be put under general anesthesia, so you'll be asleep for the C-section if it's like a real huge emergency. But thankfully mine was like not that big of an emergency, so I was able to be awake. But anyway, if you have any questions about C-sections, leave them in the comments below. If you were planning a vaginal birth but you have a C-section, I know that it can be really disappointing. I do think there's tremendous value in having the mindset that I just want my baby to be here safely and I want myself to be safe. If you focus on that, which is what I did, and you don't have a rigid birth plan, that you will be able to cope mentally and emotionally with having an unexpected C-section much better than if you had been wedded to a very strict birth plan and oh my goodness, a C-section would be the end of the world. You know, try not to have that mindset, because in my opinion, having that very rigid mindset will just set you up for extreme disappointment and birth trauma. So yeah, if you want to chat about your C-section, like if you have birth trauma, I mean, definitely seek out professional help, but I am totally open to listening. I love listening to other people's birth stories and helping people process. I mean, I definitely was just gabbing about my birth story forever. It seemed like it's just felt like I was constantly repeating it, but I think that was very healing. So anyway, reach out to me and I'd love to hear your story. Make sure to hit the thumbs up button if you liked this. And in the meantime, stay safe, stay healthy, and I'll see you in the next video. Bye everyone.